Hello, class. It's me again, and welcome to this week's presentation. Today we'll be reviewing Chapter 10 on psychotherapeutic drugs, which deals with medications that handle the management and treatment of mental disease and psychiatric disorders. I'd like to start off first by talking a little bit about psychiatric illness, which over the years has been confronted with a lot of misunderstanding, fear, and even abuse as well. Defining mental illness is not necessarily the easiest thing to do. As mentioned in this slide, a mental disorder is defined as a major disturbance in an individual's thinking, feeling, or behavior that reflects a problem in mental function. The bottom line with mental illness is it causes a significant disruption in the individual's ability to handle day to day function. Now, it's imperative to understand, and quite often we forget in the medical community, that behavioral abnormalities can often be attributed to physical medical conditions or causes, which can potentially be treated and cured, assuming that clinicians are astute enough to look for these situations. Some of the more common conditions include diabetes, stroke, which is a disruption in blood supply to the brain, thyroid disorders, infections such as meningitis, encephalitis, even a simple urinary tract infection in the elderly can lead to dramatic behavioral changes. Metabolic imbalances, such as low sodium levels, can cause behavioral disturbances. Let's not forget head injuries, uh, previous head injuries, head injuries. Uh, For example, if you know the actor Gary Busey, who was a action star from the 80s, early 90s, suffered a severe motorcycle accident and suffered severe head injuries and had a dramatic change in behavior, displaying all sorts of odd, bizarre characteristics, something you may want to look up. Neurologic diseases such as Huntington's and cerebral palsy sometimes give the appearance of mental disorder. Toxic exposures, such as certain types of intoxications or poisoning, and the list goes on and on. The field of psychiatry is the branch of medicine that deals with psychiatric disorders and behavioral abnormalities, and it's a little bit of a disadvantage in other fields such as cardiology, neurology, in that it's very difficult to make a diagnosis of one's conditions. It's not like where you can diagnose a pneumonia by watching a simple chest x-ray or a certain cancer by picking up a blood test. Psychiatric diagnoses don't really have any objective criteria. Generally, every psychiatric abnormality or illness is defined by a subjective set of behavioral characteristics, which are also listed in this reference manual called the DSM-5. Um, Mental disorders are pretty common. They affect 1 in 4 adults and quite often begin very early in childhood. What causes these disorders? Well, that's a subject of a lot of debate. Is it nature versus nurture? A lot of research is still ongoing. Another problem with finding the source of mental illness is that it tends to run more rampant in special populations. For example, some ethnic and racial minorities who are on the lower end of the socioeconomic spectrum tend to face cultural stresses that increase the risk for mental illnesses. People of low socioeconomic status are more likely to suffer from mental illness. Sexual minorities have a higher risk of mental illness compared to heterosexuals. So it appears that certain populations of people who are under high levels of stress tend to succumb more or be more prone to mental disorders. Or there is a line of thinking that some of these populations are at more risk because they have lower access to proper care, including medical care, than other populations as well. The jury's still out, and the causes still remain to be seen. Now, as mentioned before, mental illness over the years and over history has been dealt with a lot of misunderstanding, fear, and mistreatment. If you look way back in the Bible, people who behaved abnormally were deemed to have had demons and quite often were stoned to death. In the early colonial times, people with behavioral abnormalities were labeled as witches and either hung and burned at the stake. Uh, and even unfortunately, in today's day and age, we still have not completely shed the stigma of mental illness. Quite often, people with psychiatric abnormalities are portrayed comically in the media. They're often the subject of incrimination in crimes that really they have no participation in. And sometimes they're also the subject of ridicule in our own profession in medicine, which is unfortunate. And it really stems back through, again, a history of misunderstanding. Treatment of mental illness was nothing less than crude, unscientific, and largely inhumane over the years. There was very little science behind interventions. In the 1800s and early 1900s, some popular methods of treating the mentally ill included things like flogging, ice baths, restraints, close incarceration, uh, subjecting individuals to seizures by overdosing them with insulin was another popular process. You could see up in the upper right hand corner what they used to do in medieval days was a process called trepanation, where they would drill holes into the individual's skull to apparently let out the demons that was causing these abnormal behaviors. Even as late as the 1970s, if you're familiar with the journalist Geraldo Rivera, who does appearances on talk shows. He was a very popular journalist in the 70s and 80s and even 90s, and he made his real breakthrough in journalism when he exposed the deplorable living conditions at Willowbrook Psychiatric Institute in Staten Island. Patients were shackled to plumbing fixtures, sitting in their own excrement, slop fed out of buckets, hosed down with high pressure water hoses, and these were well kept secrets for a long period of time until it was finally broken through and let out into the public. But as time went by in this country, a more scientific approach developed in the assessment and treatment of mental disorders. Uh, One beginning with Benjamin Rush, the doctor whom we've talked about, mentioned before, with his take on prohibition and tobacco, was one of the first scientific individuals in the US to consider mental illness a disease and not just a behavioral nuisance. He attributed it or attributed some issues as being due to problems with the circulation in the brain. This was more conjecture, but at least it led to some little bit of critical thinking. Sigmund Freud, as pictured in the upper left corner, developed his theory of psychoanalysis, which postulated that abnormal mental behavior was rooted in deviant sexual practices and urges. This theory was largely debunked over time, but it was one of the first approaches to define cause and effect of psychiatric illness. Carl Jung further developed theories of mental illness as a result of childhood experiences and social settings. However, there are individuals such as Thomas Zaz in the upper right hand corner of this picture, outright defies the notion of mental abnormalities being an illness at all, completely blowing off the notion that some people may not be responsible for their actions even when deemed mentally ill. A stark contrast from mainstream medical literature. Another issue with mental illness is quite often there's a prominent concordance with substance use disorder as well. We also refer to this as a dual diagnosis. As seen in the slide, over one third of people who suffer with mental illness also have some type of substance abuse problems as well. Quite often, the medical community focuses on treating either one or the other of these ailments, however, still to this day fails to recognize the relationship between both. It's It's pretty reasonable to see how people who have an underlying mental illness, such as severe depression or even schizophrenia, may be using something such as alcoholic products, stimulants, or other substances as either a conscious or subconscious means of self medicating. So, one of the first terms I'd like you to try to become familiar with is psychosis. Probably use that term a lot in everyday language, but what does it really mean? Psychosis is basically means a complete or at least a partial loss of contact with reality. Psychosis can be organic in that it stems from some type of physical abnormality, such as substance abuse or toxic event affecting the brain, or it can be considered functional, in which there is really no apparent cause, which is commonly seen in people diagnosed with schizophrenia, for example. Psychosis can either manifest itself in hallucinations, in which they're either visual or auditory perceptions of things that are not there. Um, Usually, visual perceptions are a result of organic interventions such as toxic exposure, while auditory hallucinations or hearing voices is more intrinsic into disease itself, like schizophrenia, or delusions, which are beliefs that are not rooted in any form of reality and are often disturbing and cause dysfunction to the individual. Uh, a little bit different than a superstition, which are false beliefs not built in reality, and that delusions tend to be life altering and pervasive, where superstitions don't really affect a person's life too much. You know, the old saying, don't say no hitter in the seventh inning, else you'll ruin a baseball player, a pitcher's perfect game. Um, Most of the time, that doesn't affect the outcome of the game or not, as opposed to somebody who thinks the FBI is following them and alters their behavior and lashes out at people because they're suspicious. That's a whole different story. One of the most common and probably one of the most misunderstood of the psychological ailments is depression. Many people think depression is just a matter of feeling sorry for oneself and being able to snap out of it. Problem is, there's a difference between situational depression and true clinical major depressive disorder. Um, Situational depression is normal part of the human experience. Breakup in a relationship, loss of a job, financial struggles, other conditions that lead to depressed mood may affect the person, however, usually temporarily and without disruption to normal life or normal functioning. You lose a loved one, you grieve, you mourn. There's a period of time where you're sad, you miss them, but eventually build your life back up. Clinical depression involves symptoms such as severe depressed mood, loss of interest in things that were once popular in one's life, sleep disturbances, uh, appetite disturbances, sexual function disturbances, among other symptoms. The common thread in clinical depression is that it usually occurs for 2 or more weeks and results in significant impairment in one's ability to function, sometimes even leading to self destructive behaviors and suicide. And contrary to popular belief, it's not something that somebody can usually just snap out of. Anxiety disorders are also very common among the population and also met with some level of misunderstanding. Normal physiological anxiety is an appropriate response to either real or perceived danger in one's living conditions. If you're getting ready to participate in a sporting event, if you have a public speech to give, if you're going on a hot date, or if you're anticipating a very important exam on the line, it's normal to feel a certain level of anxiety as you anticipate the outcomes of these events. Anxiety disorders usually result in feelings of excessive worry, difficulty concentration, uh, sleeping pattern difficulties, problems with restlessness, increased muscle tension. However, all without the precipitating factors that we just mentioned before. So, if you think of it in physiologic terms, what happens to you when you step out into the street, you're not paying attention, and you almost get run over by a car? You jump back, your heart races, Your breathing gets deeper, increased. You shake a little bit. You may feel a little knot in the pit of your stomach. You may get a little sweaty because you almost got killed. Okay. Your fight or flight reaction, remember what we talked about? That sympathetic nervous response has kicked in to prepare you for that event. And then ultimately, the opposite occurs and your body settles down into normal mode. Okay, so think about it's not really far fetched to think about all those mechanisms engaging without the precipitating event. I don't know, just like those automobiles years ago that were recalled because the accelerators kept sticking down to the floor. If you think of it that way, and the body is just a biological machine, it should be very easy to understand how these disorders can occur. Bipolar disorder is another somewhat common condition that is probably more commonly referred to, at least colloquially, as manic depression, is a condition where a person will have major depression and then feelings of elatedness. This condition over the years, like I said, was commonly referred to as manic depression. People quite often confuse this condition with something as simple as someone going through mood swings. However, the impairment in one's life goes quite beyond mood swings. Level of depression may be so severe it is responsible for about as many as 1 in 5 suicides in the United States. On the other end of mania, these actions can be so severe can result in uninhibited behavior, spending, indiscriminate sexual practices, hyperactivity, and so on. Quite often, when a person is in their manic phase, they spend money beyond their means and initiate tasks which they can never complete. Although the cause is not yet known, there is to believe to be a high concordance of family history in this condition. It seems to run in patterns, but no one specific gene has been identified. The 1950s introduced a huge landmark in improvement of psychiatric disorders, specifically with the introduction of scientifically backed psychiatric medication, most popular of which were antidepressants. There are several types of antidepressants on the market. However, most of them have their mechanism of action rooted in those neurotransmitters that we spoke about earlier in the semester. Dopamine, for example, as we've spoken about, is necessary for alertness, motivation, and most importantly, the reinforcement of behavior linked to reward system. Norepinephrine plays a role in attention, balance, mood, and sometimes aggression. Probably one of the most important neurotransmitters to speak about is serotonin, which in simplified terms gives a sense of overall sense of well-being and satisfaction. It's very much believed in the medical literature that an imbalance in one or more of these neurotransmitters plays a big role in the pathophysiology of psychiatric illness. One of the first effective yet least common used nowadays brand of antidepressants were the monoamine oxidase inhibitors. MAO is an enzyme in the brain that activates neurotransmitters. It's not necessarily that it's often thought that low levels of serotonin and dopamine may contribute to depression um, and the need for medication. So, a medication that would inhibit this enzyme uh, would improve morale and improve mood. There are problems with these drugs. One would has to follow a very strict dietary regimen while on these drugs. They have to avoid foods such as cheeses, wine, Chinese food, just to name a few, because the amino acid tyramine in these food can interact with these medications and cause a precipitous drop in blood pressure, as well as other side effects. Another issue with monoamine oxidase inhibitors is that they are absorbed and metabolized erratically, making it kind of difficult to determine a therapeutic dose. There's also some evidence that these medications are affected by circadian rhythms and work better as a person's depressions become more acute as the day progresses on. Other antidepressants, such as amitriptyline, nortriptyline, are called tricyclic antidepressants, and they're named after the chemical three-ring structure that are very effective for treating unipolar depression as opposed to bipolar depression. They also work somewhat as well for social phobias and bulimia. However, they take approximately 3 to 4 weeks to demonstrate an effective response. The delay in response with these, as well as other antidepressant medications, can sometimes lead to medication discontinuance and noncompliance. TCAs can be extremely toxic in overdose, causing lethal heart arrhythmias and cardiac arrest. There are also many medications that these drugs cannot be mixed with, such as certain antibiotics and anticonvulsant medications. Typical side effects would include fatigue, dry mouth, blurry vision, and constipation. Sometimes these medications are used to treat other conditions off label, such as migraines, chronic pain, and sleep disorders as well. In the late 1980s, a new brand of antidepressant was put on the market called selective serotonin reuptake inhibitors. Brands such as Prozac, Zoloft, Lexapro, Luvox all made their way onto the market and touted a much greater safety profile than the traditional TCA antidepressants, although none of these medications are without some risk. These medications work specifically by inhibiting mostly the serotonin reuptake while having very little effect on norepinephrine and dopamine. These medications have been prescribed for conditions such as major depression and generalized anxiety disorder as well, obsessive compulsive disorder, and even some off label indications. Um, as with other types of antidepressants, it takes time to appreciate the effectiveness. Results are usually typically seen within about 4 to 6 weeks. Typical side effects include, again, dry mouth, fatigue, blurry vision, and sexual dysfunction, which quite often leads to abandonment of therapy. The general safety profile of these drugs has been agreed upon by most professionals, but again, they're not without risks. In the early 1990s, a major lawsuit was filed against the makers of Prozac, accusing the manufacturer of withholding data suggesting that Prozac led to some isolated cases of suicide and homicide. There have been reports of medications such as Lexapro and Paxil contributing to suicidal ideation and incidents in pre-adolescence. Despite the previous lawsuits, both Prozac and Lexapro continue to be widely prescribed. Some newer antidepressants have been on the market since the early 2000s, known as selective serotonin reuptake and norepinephrine inhibitors. Examples of these medications include Effexor, Cymbalta, and Pristiq. Manufacturers of these medications claim fewer side effects and some other off label indications, such as treatment for chronic pain. The last classification of antidepressants to mention are called the atypical antidepressants, which really don't fall into any one particular category. A popular example of this would be something called Wellbutrin, which works primarily on dopamine receptors when it's indicated for major depression. It's also the main ingredient in some smoking cessation programs, one of which was commercially sold as Zyban. Um, and one of its big selling points is it does not lead to the sexual dysfunction that other traditional antidepressants, such as the TCAs and the SSRIs, tend to deal with, um, making it somewhat of an desirable alternative. However, some of the side effects or the dangerous effects of these medications include seizures and hallucinations if small overdoses are taken. Again, the prescribing of any of these medications has always been met with some level of debate and controversy. There are some people that believe that the prescribing of antidepressants are sometimes overprescribed, inappropriately prescribed, should only be prescribed by psychiatrists and not primary care physicians. There's sometimes belief that in nursing home situations and hospitals, patients are given Some types of antidepressants more for their sedating qualities to give the staff a break rather than what's therapeutically necessary for the patient. Um, there is no denying, though, that in the proper circumstances, these medications do tend to offer some benefit when indicated. The big thing to remember is that they don't work on demand. You usually have to build up quite a bit of a blood level over several weeks to notice any type of effect. Um, Another problem with these medications is one of the ways that you know that they're working is when the patient feels like they don't need them anymore. And that's usually a problem with compliance. Um, but either way, sometimes it's a matter of also picking and choosing what works for the individual. What works for one doesn't always work for another, being that everybody's chemistry is different. Quite often, to have successful treatment with these medications requires a little bit of trial and error. Earlier, we mentioned some of the barbaric and inhumane treatment of patients who suffered from psychotic episodes, partly due to misunderstanding and partly due just to the evil nature of some individuals. Just a side note, but something you might find interesting. One intervention that you would think would be cruel and inhumane in treating severe depression and psychosis, which was actually very quite medically effective, was that of electroshock therapy. The placement of electrodes on an individual's head, giving them mild sedation, delivering an electrical shock, and inducing a brief seizure. It sounds like the story out of horror movies. And if you ever saw the movie One Flew Over the Cuckoo's Nest, you'll see how evil staff actually used it as punitive measures. But again, that's a fictional novel. But it actually is very, very effective in treating severe refractory cases. Uh, but away from that tangent, the treatment of patients suffering from psychosis was really revolutionized with the introduction of antipsychotic medications such as Thorazine and Haldol, to name a couple. These medications permitted many patients suffering from schizophrenia and other psychiatric disorders to live somewhat functional lives outside of the institution, albeit at some cost. These medications come with many side effects, such as catatonia or a zombie like affect, leaving the individual almost expressionless and lacking purposeful interactions. Dystonia, which is an abnormal contraction and twitching of various muscle groups, sometimes resembling seizures. Tardive dyskinesia, which is abnormal motor movements of the mouth and facial muscles. Some of these medications, such as lithium, for example, can be extremely toxic and require periodic blood monitoring every so often to make sure that levels do not reach that toxic point. An unfortunate situation with the administration of psychiatric medication is still the stigma that comes with mental illness. Many patients fail to report taking these medications when seeking either urgent or emergency medical care. That's sad because this can sometimes lead to dangerous drug interactions or overdosing of medications, especially when we don't have any previous records on people. So, hopefully, with any part of this lesson may help open your eyes to the importance of proper treatment for patients with psychiatric illnesses. Cap on this week's lesson. I'd like you to understand a little bit about the definition of mental disorder. Examine special populations at risk for mental disorders, such as lower socioeconomic, sexual minorities, and certain racial and ethnic groups. Elaborate on the connection between mental disorders and substance abuse. Remember, we talked about dual diagnosis. We didn't really speak much about the difference between psychosis and neurosis. Neurosis is really a catch all term for anybody with abnormal behavior. List the various types of mood disorders that we spoke of, most commonly, most importantly, major depression, anxiety, and bipolar disorder. Identify the risk factors that are faced by ethnic and cultural minorities regarding mental illness. Go back in your book and read up on that. Compare and contrast the various types of antidepressants, the MAOAs, the tricyclics, the selective serotonin reuptake inhibitors, the atypicals, and the serotonin and norepinephrine reuptake inhibitors. Elaborate on the conditions for which lithium is most effective. It's most effective as a mood stabilizer to help prevent those highs and lows for the patients with bipolar disorder. Judge the effectiveness of antipsychotic drugs. I think there's a couple of videos on your classroom folder. Explain the dangers associated with abusing and mixing psychotherapeutic drugs, especially with illicit substances, and give you some food for thought. And with that, have a great week. Answer your discussion questions, and we will catch up next week when we talk about, I believe, oh yes, synthetic and performance enhancing drugs. Have a great day.